Medical Dilemma.
Welcome back to Medical Dilemma. I'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment of our discussion are my co-hosts, Father Jerry Manlangit.
Hi, Zare.
And our Doctora Attorney Tess Sanchez, our medical legal expert.
Hi.
Okay, now starting the discussion for the second segment. Before we took a break, you were mentioning the screening process for cancers in the gastrointestinal tract. Maybe we should start from there again.
Yeah, again, simply screening means to check all and the whole population for the possibility of having the pre-malignant lesions in the gastrointestinal tract. Pre-malignant means hindi pa siya cancer noon. So if you could check it and if you could remove it, which is what we can do endoscopically, if they're small enough or even large ones, and we can remove them, then there lies what we mentioned earlier to be cancer prevention.
Doc, does all polyps lead to cancer, or there are those who just remain as polyps?
That's a good question. No, not all polyps will lead to cancer.
Okay.
The trouble is, you can't tell which one will and which one won't. So across the board, just remove it.
Yeah, safer.
Whatever
for
it
peace of
will
mind.
eventually become, it doesn't matter because you removed it.
Is diverticulitis the same, or does it also lead to cancer, or what?
Okay. You mentioned diverticulitis. That's a reverse. A polyp is an outgrowth inside the mucosa. Diverticulitis is a pocket. It's in Tagalog a bulsa, a pouch that one can get along the entire gastrointestinal tract.
Okay.
The nice thing about diverticula, or the pouches that I'm mentioning, is they have no malignant potential.
None at all.
Good news.
The most that can happen to them is pwedeng mapasukan siya ng dumi.
Okay.
And it can get irritated, and sometimes it can in fact perforate or pwede siyang mabutas.
In which case, it would be an emergency, right? Not really.
Depends. Nowadays, surgery will still be the first choice that we'd like to do here. Repair it, remove it, or treat the infection that will ensue, because if you have to imagine, the contents of the colon will now escape into the lining of your abdomen, wherein you'll develop an infection. So you may need urgent surgery.
So it may not be cancerous, but it could also be life-threatening in
Yeah,
some
there
other
are
way.
instances. There are instances. But if I were to make a choice between the two, I'd rather. And diverticular disease is sometimes also a subset of the aging process. The older you become,
Oh my.
the more
That's bad news.
the more
So
you
the
can.
greater the chances of getting it.
Right. But when we see it, we just say that, oh, you have pouches there. Maybe you have more than you had 10 years ago, but it has no impact as far as treatment or malignancy is concerned. So you just know it, diba?
Yeah.
You just know it.
You know, Doc, some celebrities have, I know of one who died allegedly of bangungot, no? And some workers, etc. Is anybody, male, female, are they candidates for this? Who are the candidates for bangungot? And what is that in foreign or English terms? Because bangungot is
Something,
a local
is it
parlance.
something connected with the gastrointestinal system, pancreas, whatever?
Hindi ba pancreas? Acute hemorrhagic pancreatitis.
Well,
Right.
I've been warned many times, don't sleep on a full stomach.
Yeah,
So
especially
you could get bangungot.
That particular, I'll take off on that particular. When you sleep on a full stomach, that will just lead to, I think, discomfort. Busog ka eh.
Just discomfort.
Yeah, and then you go to sleep. The stomach takes 3 hours to empty in a regular individual. If you were full and you were to sleep, you lie down, the contents of the stomach can regurgitate back and produce some discomfort, and they call that reflux sometimes.
Reflux.
Yeah, yeah.
Or
Right.
what you call na impatso in Tagalog, yung indigestion. You couldn't digest the food well because you lay down. No? There's no direct correlation between doing that and suffering from what they call that bangungot thing that you're mentioning. There are so many terms that they use about it. There are movies about it.
Yes.
There's folklore about it. There are myths about it.
But they say there's too much production of enzymes that sort of eats the pancreas and autolyzes it, or parang kinakain.
Not conclusive.
There's such a thing as pancreatitis. There's such a thing as
Ayan.
pancreatitis.
And that
But,
is caused by the pancreatitis itself.
Usually, the most common reason for pancreatitis is because you have a gallbladder stone. They are in
Okay.
close proximity to each other, the
Gallbladder
pancreas
stones.
and the gallbladder. That if the gallbladder stone gets impacted, it produces a concomitant inflammation of the pancreas. That's the most common reason. The other one is our favorite pag-inom ng alak. No?
Okay.
And that's
So,
why. Yeah.
Drinking.
It's related to alcohol because it directly injures the pancreas. But mostly, the reason why people get pancreatitis, aside from those two reasons, is unknown. Some people just get it because they get it. Now, there's a difference between what you mentioned, pancreatitis, and yung bangungot. The difference lies in the fact that the patient or the individual is dead by morning. Right?
Right.
I mean,
Yes.
that's how
Right.
it, they were seen well, usually
Before
a medium
sleeping,
build,
yes.
Right.
malakas sa kanin na trabahador, na ganon, and then kumain ng marami, natulog,
Lechon.
nag-snore,
kasama lechon.
Right.
diba? Umungol, and then by morning, matigas na yung,
Yes.
yung
Katawan niya.
katawan
Oo,
niya,
yeah.
no? Which is not what you have in pancreatitis usually, although they say that it's related to that. The pancreatitis that you usually see is severe pain, which necessitates you to come to the hospital. So there lies the difference. You see, you have the ability to still go to the hospital and be admitted and then treated. You know? Unlike the bangungot syndrome, which is related
have
to
no chance
so many
anymore.
organs, maybe the
Dramatic
pancreas,
and
maybe the heart,
dramatic.
maybe it's the heart. No?
Uh-huh.
And I think the reason why we don't know what causes it is because here in our country, hindi tayo madalas nagpapa-autopsy. It is not standard here
Yes.
in the even in the medical legal, I think. No, we have very few autopsies done. And
Although under medical legal, it's mandatory. Supposing bigla nang nakita mong patay,
They
you
should,
have, yes, you should,
So the
because
law
there might
says
be
it's
foul play.
mandatory. It's mandatory.
It's mandatory,
Under
and
the
you
law.
don't need consent from the parents, whoever, because normally they will not give consent, di ba?
Normally.
They don't like to see the body.
Disfigure the body.
Yes.
Yes.
oo.
right.
But-
But only if evidence says would indicate that there are foul plays
Yes.
or something like that.
Yeah, but father, sudden death, and you don't really know the cause, di ba? Kahit nasabihin, well, I suppose, pwede naman maglusot yun. But even if they die apparently in bed and in the family household, you don't know. You have to
But
rule
for,
out other things.
as you mentioned, for third world countries, autopsy is not the usual practice. First, of the financial implication. No, who will shoulder it? The family, government? You'll never know. Nobody wants to spend for it. So the family, anyway, it's okay.
Unless medical legal, then it's
Right,
the government
medical
that
legal is
shoulders it,
supposed to
yeah.
be,
Yeah.
well, there is a legal obligation on the part of those people, even the doctors, for example, in hospital, to inform the concerned agency so that they can do what they are supposed to do.
Yes.
Yeah.
So-
Knife wounds, bullet wounds, etc. Tinatawag na reportable cases.
Right.
Tingnan mo yan.
But secondly, the relatives usually don't want to give consent. And
Right.
Yes.
when they say no, the physician has also the reflex not to also force them.
Yes.
You know, you ask them once, they say no, you don't say again and again. No, we shy
Right.
away from that.
Yes.
Which is why the numbers for your question about bangungot are not, you know, we don't have that much
accurate,
data.
di masyadong,
There's
yes.
not much data as to what causes it.
But how about in the West, doctor?
I would believe it's standard there. When they have a death, there are autopsies there left and right.
Are there no medical
Studies.
evidences
Yes.
to establish the cause of
Bangungot,
something
for
like that.
example.
Okay. Curiously enough, even if they had the autopsies there, the numbers are more seen in Asian men.
Asian
Oh.
men.
Yeah, I don't know if you realize that, no?
I see.
Yes,
It's
yes,
our
I've heard
side
of that.
here, eh. You know, abroad hindi masyado. It's more seen
Bangungot.
here. And again, there lies the reason why we don't have the numbers. It's more seen with us, and we don't have the autopsies. Now, all we have are the circumstances.
Mhm.
They were seen the night before, apparently well,
Mm.
Right.
and
All
then
of a sudden, that's it.
the next
So
day.
it's more of alcohol related rather than fatty foods, or what?
Well, the nice thing about fatty foods is it takes a long time for it to injure the gastrointestinal tract.
Okay.
And most lethal effect that it has is on the liver, causing fatty liver.
Uh-huh.
Alcohol directly attacks the pancreas.
Ah, so
Well,
that's
Doctor, the problem is fatty foods always come
With
well
alcohol.
with alcohol.
mga pulutan and
So it's
everything.
really
Yeah.
hard to distinguish
So,
the effects of one
oo.
from the other.
Yes. Oh, kaya nga. So,
Right.
And-
They always go together.
Another issue is we have a lot of diarrhea cases, and sometimes they cannot rule out infection, and particularly HIV/AIDS. No, Father, what do you think about this? Because
Well, about
it is supposed
disclosure
to
probably
be, yeah.
and information,
Mhm.
those issues would come in. Well, when it comes to other diseases, it's very easy to disclose it. It's very easy to inform, or the confidentiality is not that strict, for example. But when it comes to, well, as I've said, HIV, there are protocols, for example, that we have to follow. Otherwise, we will be in trouble. The doctors will be in trouble. Well, even the hospitals will be in trouble. You know, we have always to protect the confidentiality of the privacy of the person. Well, well, probably because, you know, the culture in medicine is, you know, social diseases, no? Is always connected with a sense of shame.
Yeah, may
So
stigma
when it comes
pa
to
rin eh.
HIV
There's
or
still
something
stigma
like that.
here, Father.
So that
Right.
stigma there,
Oh.
doctor.
Maybe it was, you can make a similarity. Before it was tuberculosis.
Right.
I mean, you didn't want to disclose that you had tuberculosis because you were ashamed about it.
Yeah, because as there's a culture,
And people
because
shy
it is
away.
a
Kala
disease of the
nila.
poor.
Ah.
That was
Yeah.
before.
And they shy away
nobody
because they
wanted to
think
admit
you'll
they were
infect
poor.
them. You'll infect them.
Or the Hansen's disease.
Right. Yung ketong.
Keto,
Ah,
something
oo.
like that. Or even, for example, the disease that comes from the rats or something like that.
Leptospirosis.
Leptospirosis.
Ibig sabihin, rat infested yung
Rat-
bahay mo.
so
or what?
there is a sense of shame, social stigma for that matter.
Okay,
Right.
we'll have to take another commercial break at this point. Don't leave this channel. We'll be right back after a few words from our sponsors.
You don't know it.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?